A warm welcome from the NAACP, Roy Wilkins, Mid-Manhattan Branch. Tonight's presentation is brought to you by the Health Committee. Our health is our wealth.
Good evening. The Health Committee is pleased this evening to present a program to you. We're going to have a little bit of serious discussion, and then we're going to have a little bit of fun, and then we're going to have a brief presentation. We're going to begin tonight with our first speaker, who is Dr. Mary O'Brien. You may remember Dr. O'Brien as a colleague of Dr. Don Dayson, who is a member of our Health Committee. And so we're pleased this evening to welcome Dr. Mary E. O'Brien as our guest speaker. Dr. O'Brien was invited to speak with us this evening by Dr. Dayson. She practices medicine at Columbia University Health Service and is a member of Physicians for a National Health Program. This is a nonprofit research and education organization of over 18,000 physicians. And I hope that you're going to give us a little bit of an update on the legislative progress that has been made with the single-payer health system moving through the legislature in the state of New York. So there's been some real progress. Before we are we ready to do that? Sure. We've got some copies of Dr. O'Brien's presentation coming around. Without further ado, I welcome Dr. Will you welcome her with a round of applause?
Thank you very much. It's a pleasure to be here. If anyone can't hear me, please let me know. So we gave out a handout that goes into more detail than I'm going to go into tonight, because I'd like to talk for about 10 to 15 minutes and then leave time open for people to ask questions, because there's been a lot of changes in our healthcare system over the past few years. So I'm first going to just outline where we are now, what the ACA, the Affordable Care Act, represents, and then what are some of the ideas of Physicians for a National Health Program and our own New York State single-payer bill. So if we look at the American healthcare system, we spend about $2.8 trillion a year on healthcare. That's almost $9,000 per person. It's nearly twice as much as any other country spends on healthcare, despite the fact that these other countries cover everyone. They have national health care and they cover everyone in their country. We spend twice as much, and we still have about 50 million people in this country who are uninsured, and so have very poor access to health care other than emergency rooms, and many of them go bankrupt if they get sick and need to pay for health care. That's just part of the picture, because there's a lot of people who are what we call underinsured. On paper, they have an insurance plan, but it's too skimpy for them to be able to afford care. It may have a high deductible, so that they have to spend $5,000 or $6,000 of their own money before the insurance will pay anything. And that prevents people from seeing a doctor even for serious problems. Even if they pay their full deductible, they often pay a co-payment every time they see a physician, which can be $30, $40, $50, and oftentimes pharmaceuticals and other things aren't covered. So there's a large segment of our population who either has no insurance or who does not have adequate insurance for them to get high-quality health care. This is really not acceptable for a country as well off as the United States. So, how did we get here? And if we pay so much money, do we have better health outcomes? Unfortunately, we don't. We have a higher infant mortality than almost any other Western country. We have a lower life expectancy, and we have a higher maternal mortality. So that in our country, there's a lot of inequities. There are some people who get absolutely world-class care, and there are 40,000, 50,000 people who die every year for lack of adequate health care. Now, we differ significantly from all the other Western countries in one main way. We treat health care as a very profitable business whose main concern is making money. Patients are not the priority. this is completely wrong. We pay, because of this, about 30 cents on every healthcare dollar for administration. 20 cents goes to the insurance companies for all their profits, and the rest is divvied up among billing for hospitals and for doctors' offices. This is a very inefficient way to run a healthcare system, and we're not going to be able to cover everyone unless we do things more efficiently. Now, we have a very good example in our country of how to provide healthcare efficiently, and that's our Medicare system. Medicare covers everyone 65 years and older, and it covers everyone who's permanently disabled. It's a publicly funded system, and it spends about 3 cents on every dollar for administrative overhead. So almost all of their money goes to providing health care to those who are on Medicare. And I'm going to talk in a little while about how we could do that, both on a state level and on a national level, and guarantee everyone health care. So what is the Affordable Care Act? After Obama was elected president, he put as one of his highest priorities reforming the healthcare system. And he said to Congress, we'd like you to come up with a plan to reform healthcare. At that point, Congress really had to make a decision. Did they want a healthcare system in which healthcare was viewed as a human right that everyone in our country should be guaranteed? If they decided that, the only way they could do this was by having an expanded and improved Medicare for all. What they did instead was they decided they were going to keep the for-profit healthcare system we have, with private insurance, with pharmaceutical companies, with all the high costs of our healthcare system. And they were going to adjust it a little bit so that we could get more people in the system. And that's basically what the Affordable Care Act represents. It will provide health insurance to more Americans, but I strongly believe that we can really do better. We know how the health system should be reformed, and we can really reform it better. So what the Affordable Care Act has done is a few different things. Part of the initial plan was to expand Medicaid in all 50 states. And the federal government would pay 100% of the costs of that. So basically the states would have no increased money they had to pay to ensure many more people on Medicaid. Everyone who made up to about 138% of federal poverty, which for an individual is about $23,000. However, there were a lot of objections to this. It was brought to the Supreme Court, and the Supreme Court decided it was the choice of each state as to whether they wanted to expand Medicaid. 24 states elected not to expand Medicaid. Most of those are Republican states. Many of those are in very poor areas of the South. There's no logical reason why they should have refused. Their states were not paying any money for it, and it would simply expand health care to many people in their state who don't have access to it and allow them to get good treatment. There have been lots of people within those states who are trying to convince them. There's a movement in the South called Moral Mondays, which you may have heard of, where people are gathered together once a month to really push states to accept Medicaid. But basically it's moved nowhere at this point. And what it means to people is there's about 8 million people who otherwise would have had Medicaid through the Affordable Care Act who are being denied Medicaid. And this is even worse because the way the state exchanges are set up to provide access to health care for people, anyone who's under 100% of the poverty line can't go to the exchanges because the system was designed that they would all be on Medicaid. So that there are a lot of people in those states who now are just left out in the cold. They don't have Medicaid and they can't go on the exchange even if they want to pay for it themselves. People who are between 100% and 138% can go on the exchange and they may be eligible for some subsidies. So there's a large group of people who are absolutely excluded from health care under this system. Now, all of you have probably heard about the state exchanges, which got off to a pretty rocky start. And in our system, what we're doing in expanding health care is the government is paying subsidies to private insurance companies to provide insurance for those people who don't get it through their employer and who aren't eligible for either Medicare or Medicaid. Now, the difficulty is that the private insurance companies have put in fairly skimpy plans. The bronze plan covers 60% of your health care cost. The silver covers 70%. The gold covers 80%. Now, paying 60% of your health care bill is not enough for anybody. Healthcare is way too expensive to say we're going to pay 60% of your cost. So it starts off with not enough health insurance. And then, in order to keep the premiums affordable, they've put in deductibles for everyone. And the deductibles range from $2,000 to $6,000. So before you get any money paid by your health plan, you're going to pay that deductible. And then you still will pay co-pays when you see your doctor. And then the last way that they've made the plans more limited is they've set up what they call very narrow networks. For most of us who have insurance from our employers, you can see someone within network, usually for a fairly low cost. But if you want to go out of network for an unusual problem or cancer or something like that, they'll pay an out-of-network fee. On the exchanges, you cannot go out of network. Nothing will be paid at any point. And in many areas, very significant hospitals are being excluded. In New Haven, all the Yale New Haven hospitals are excluded from the exchanges, and they're the top hospitals. So that there's been a lot of things done to try to save money. And the insurance companies are quite happy to be getting all this extra business. So yes, we are insuring more people, but it is really not an efficient way to do it. And the increased administrative costs that we'll pay will really be significant. And we'll still be dealing with these problems of healthcare getting more and more expensive, and all of us having to worry about, if I get sick and I want to see a doctor, will my insurance pay for it? So, is there a solution to this? Well, if we look at other countries, and it's often helpful to look at other countries to see how they do things, we'll see that many other countries have put into place what's called a single-payer health plan. Canada is probably the closest one who's done that. And what that means is that money goes into a public fund, and then it pays for health care for everyone in the country. So what we would have would be an improved and expanded Medicare. Medicare is very good, but there's lots of things it still doesn't cover. So the expanded and improved Medicare that would be here under a single-payer system would cover, without co-pays or deductibles, doctor visits, dental care, mental health care, hospitalizations, pharmaceuticals, and long-term care. So all the essentials that you need for health care would be covered by this from the day you're born until you die, regardless of whether you're employed, regardless of whether you're disabled. You would have access to health care simply because you're a human being. And many countries have done this. It's been very successful, and they have very good outcomes in terms of health. And if you ask people, do they like their health care system, they do. And if you did anything to tamper with it, take it away from them, people would be out in the streets. So there's a bill that's been in Congress that is unlikely to be passed soon because of the Affordable Care Act has already been passed, which is H.R. 676, with John Conyers introduced in the House. Well, what's very exciting right now is that many states are saying, look, we may not be able to get federal single payer at this point, but let's do it on a state level. And this is the way Canada started their national health plan. One of their provinces, Saskatchewan, started a single payer program, and the other provinces said, oh, this is really working great. In New York State, we have a bill called New York Health, which is actually doing quite well. Gottfried sponsors it in the Assembly, and Bill Perkins sponsors it in the Senate. Currently, we have 71 votes in the Assembly, which is plenty to pass it in the Assembly, and we have 19 votes in the Senate, and we need about 31. So we really have substantial support for this in New York State. And we just went up on May 6th. We had about 250 people, nurses, medical students, doctors, union members, lots of people from New York State, to go and meet with people in the Senate and the Assembly saying, this is really critical. We need to have everybody insured, and we can do it by having a single payer plan. And so that's where we're moving towards right now. We have many, many more people and organizations supporting it. I'll just read a few of them. 1199 SEIU, they're United Healthcare Workers. 32BJ SEIU, the African Services Committee. Healthcare Now, we have the New York Academy of Family Physicians and the New York Psychiatric Association. The New York State Nurses Association is a very large union. The New York State AFL-CIO, Physicians for National Health Program. A very large number of organizations are behind this. We hope that you all will consider being behind it as well. In the legislature, the caucus for Black, Puerto Rican, Hispanic, and Asians are behind it and are supporting the New York State bill, so that we hope that that will become a program and be an example to the rest of the country. Already, I think New York State provides some of the best health care in the country, and New York City, with its large public hospital system, also provides a much better safety net than many other places. But we still have a lot of New Yorkers who are uninsured, even despite the new plan. In New York, we have about 19.5 million people. Currently, about 5 million people are on Medicaid. We have a very generous Medicaid system. About a quarter of the population is on it. You don't have to be a citizen to be on it. You can get emergency Medicaid if you're hospitalized for serious problems. So we have a much more generous system than most states. But we still could do better, and we could do much better if we have single-payer health care. So I'd like to close with that sort of very brief overview, and I'd like to answer your questions about it.
Ms. Bostic is coming around with some copies of Dr. O'Brien's presentation. Thank you, Ms. Bostic.
Yes.
Doctor, how will this impact the quality of services at the state level? When I listen to various pundits talk about the quality of service, they're thinking that because the prices or the cost of the premiums are being brought down, that the quality of the service delivered will be also watered down.
Well, that's a good question. If we move to a single-payer system and we remove the overhead of private insurance companies and all the billing that we have in hospitals and doctors' offices, one example of that is Massachusetts General Hospital, which is a large Harvard hospital, has more than 300 billers. Toronto General, which is the same size, has 3 billers. So we're wasting a huge amount of administrative money. It's estimated about $300 billion per year. If we took that money and put it into providing people efficient, publicly funded health care, we would be spending the same amount of health care dollars, but we would be paying for even better health care because we wouldn't be wasting so much of it. So I don't think the level of health care would change. I think actually it would improve, because what other countries have done, once they have an organized national system, is they have much better data on how physicians and hospitals perform. And so you get a better sense of, was this care necessary? What's your outcome like for surgery? How many side effects do you have? So it gives us a much better handle on establishing excellent standards and making sure that everyone's adhering to them. Yeah.
And I have a second question.
Okay.
Are there third-party entities that are responsible for making sure that the delivery of health services, is to a certain quality level?
Well, yes, there's a number of ways to do that. Right now, we do it more in Medicare and Medicaid. So most studies you see on the quality of health care in the United States look at Medicare because we have data on them. We have very little data on all the private insurance companies and the quality of care and how people do under that, unless a separate study is done. So what most countries do who have this is they have a group consisting of government officials, citizens, and healthcare people, doctors and other people in the healthcare system, who come up with how to use the money, how to devise it, and then set standards on the quality of care and then monitor it. And it's also looked at by international organizations. There's a lot of very good data under OECD, which is the Organization for Economic Cooperation and Development, which looks at about 30 countries and looks at their healthcare outcomes, how they spend money, what their life expectancies are, and so they would continue to look at that in the United States. But those are all very good questions, because what we want to do is improve healthcare for everyone. We don't want people just be going to ERs and not getting their medicines and all of that. And this would allow us to do it. But it's going to be a big project overhauling the delivery of healthcare, because it's very disorganized at this point. People don't have a primary care doctor who coordinates their healthcare. Says, I'm going to send you to the cardiologist. Let me see what that person says. Okay, well, let's talk to this person. Okay, you're in the hospital. Let me speak to the people in the hospital, so when you come out, we know what has to get done. That really improves the system and allows us to make sure that your care is good and that it's coordinated, whether you're in the hospital or whether you're at home. Yes?
Do you foresee in something called universal health care for all, for us at some point in some time? Growth and opportunity can occur only if we advocate for ourselves. I'm in mental health, and I see where people get turned away
Absolutely.
because they don't have the appropriate coverage.
That's a very good question, Dawn, and I would say that under this system, single-payer healthcare is a universal healthcare system. It would include everyone, and it would not exclude immigrants or illegal aliens because they're a part of our country, and we need to deal with everyone's healthcare because, you know, we don't want someone walking around with tuberculosis or something like that as a threat. So this would cover everyone, and it's interesting because there's a lot of misunderstanding about the use of healthcare resources by illegal aliens. It turns out they use substantially less than Americans do, that they pay into Social Security and Medicare but have no option of using it because they're not citizens. And so if you look at the balance, they're paying more into our system than we're getting out of it. So it would make a lot of sense to include everyone in it. But yes, and mental health would be guaranteed under this, which is quite different than what we have now, where it's really variable and there's a lot of mental health needs that aren't addressed. Yep.
Under the single payer, if that was to be implemented here, it's kind of like a twofold question, because right now on the market exchange, they don't even consider what an individual or family's budget is.
That's right.
So is that, do you have any knowledge of whether that is going to be implemented before the single pay, even if the single payer plan is not implemented here, will that ever come to pass? Because right now, I don't even understand, all these insurance companies, they don't even ask anything about your budget, but then they expect you to pay these high premiums. Everybody is going to start defaulting on their premiums, and to me, I think it's going to be this a domino effect. And we're going to be right back where we started, or even worse.
Yeah, that's a good point. Now, it was designed in state exchanges that there would be subsidies up to 400% of the federal poverty limit, which for a family of four is about $90,000. So any family with income under $90,000 would get certain subsidies to help pay for their premiums. But you're right, it doesn't include that if you have a deductible of $6,000, where are you going to get that money from? So I agree with you. I think that's going to be problematic. The way single payer is covered for is similar to Medicare, so that there would be a similar deduction from your paycheck of like 3%, which is kind of less than we pay now for Medicare. Employers would contribute as well, but probably less than they do now when they're covering private insurance because that's so expensive. And then the federal and state governments would continue to put in what they put in for Medicare and Medicaid. There's kind of a diagram of it in the handout. So that almost everyone, except the very wealthy, would be paying less in total for their single payer. And if you were unemployed or disabled, you wouldn't be paying anything. So it really would be a more progressive way of paying for it, because it would be based on your means, and you'd pay according to your means. It wouldn't be that the CEO pays the same as the secretary, because that's what the premium is. Yes?
The healthcare bill that's in, right now in Albany, the two different bills in the Assembly and in the Senate, was that one of the reasons why the healthcare providers in the medical community went to Albany? Well, how did that help this bill, and what can other citizens do about
Oh,
this
you can
bill?
do a lot for it. That's a very good question. Yes, that's why we went to Albany. And this bill has actually been introduced in the Assembly and the Senate since the mid-90s. But there's much more grassroots behind it now, because people understand that we really can't fool around with this. We really need to have a medical system which places patients as the priority. That's not going to happen unless we push for it to happen. The insurance companies, the pharmaceutical companies, the huge hospitals, they're too powerful. They're not going to give up all this money that they're making. So it's only going to be when there's a large grassroots movement of groups like you all and all the different grassroots groups there are that are both voting for people who support this as well as lobbying Albany. I mean, it was very, when we go to Albany and, 250 people, it's very clear when you see the nurses in their red shirts and uniforms that they wear, and the doctors in white coats, that people are really serious and they want the system to change. So yes, you can lobby in Albany. You can contact your assembly person or senator to vote for this. You can see if the Mid-Manhattan branch of NAACP wants to officially support it, as a number of other groups have. But until we get really strong grassroots support, both on a state and a national level, you're right, this isn't gonna get passed. So
We've
we'll
got
give you-
time for one more question in the back. I can see you since.
Hi, I've been reading where numerous urgent care centers are opening up all over New York.
Uh-huh.
What is your opinion about them, and are they replacing the emergency units in the hospital?
It's really it's a very hard question. So they're kind of filling a gap in that in New York City, we really don't have enough primary care doctors to take care of patients. We have loads and loads of specialists. So what these places do is you can walk in and get seen anytime. They don't have the capacity to handle you if you walk in and you're having a heart attack, or you have some severe problem. But what happens is they do somewhat throw off the system, because emergency rooms are very expensive to operate, and they kind of balance themselves a little bit on people coming in with less serious things and then people coming in with, gunshot wounds or terribly serious things. If most of those relatively healthy people with a broken arm or who need sutures or something like that are all filtered off to urgent care, it's going to make it much more expensive for ERs to operate. And another concern is that ideally we want people to be followed by a regular physician or nurse practitioner who knows you and knows your medical problems and your family and things like that, so that we can follow you more closely rather than seeing a different individual each time who may not pick up whether your symptoms represent something serious or just something that's going to go away. So.
Thank you so much, Dr. O'Brien.
Oh, you're
Once
welcome.
again, you want to We're going to go a little bit off. We're going to stay in session. We're going to go a little bit off before Mr. Rutledge. We invite Mr. Rutledge to come because once he comes, it's going to be a party, and we can't control it. So ever since she's been elected, our Manhattan Borough President Gail Brewer has either attended or sent a representative to every single one of our meetings. Is that correct? President Eaton? And tonight is no exception. Our Deputy Borough President is here tonight, Mr. Joseph Garba. I'm going to ask Mr. Garba to come forward. Mr. Garba has agreed to make a presentation on behalf of the American Cancer Society tonight.
Thank you very much. Can everyone hear me? Yes. I don't use microphones, so I hope this works.
We can see you also.
Great to see you. It's great to be here again. No, I was here last month with Gail. We spoke on the affordable housing panel. So I was really enjoying the speaker this evening, talking about affordability and access to healthcare, which is really, housing and healthcare are really two of the crucial issues facing our communities these days. So it's wonderful to hear, these topics you picked to address this evening. What we're working on? We're still working on affordable housing. Last time we were here, we talked about some of the work we've been doing. We have these task forces we've put together in our office. We've been working with developers, community, affordable housing experts to figure out ways we can help the mayor's administration develop new affordable housing units here in Manhattan, help preserve the units we have now. This is an impossible task. We all know how difficult it's been, how many units we've lost over the last decade. We continue to fight this fight. We were all pleased with the mayor's proposal he put out at the beginning of the month. We look forward to working with them to make sure it becomes a reality and that all 200,000 units are provided for the communities. So it's really, that's been a lot of our efforts so far. But it's, it continues. It's nowhere near close to finish. So we'll be working on that for a while. And we look forward to all your help, all your criticism, all your advice on how we can do more to make sure this becomes a reality. So really thank you very much for having the folks here last time to discuss that issue, and we continue to talk about it here. But while I'm here, I do want to, while we're on the topic of healthcare, I would like to commend your president for the work he's done. I don't know how many of you are familiar with the American Cancer Society and the work they've been doing to try to cure cancer. They've been at this for a long time, and we all know how, what a difficult issue this can be to our families, and we have loved ones who have this very, very devastating illness. And your president partnered with the American Cancer Society to find out, they were having trouble identifying minority participants to take part in their studies, to figure out ways we could treat cancer in minority communities. And your president worked with them very quickly to identify, was it 75 individuals who came forward to help with this very crucial work. And it's very important work. Yes, please give them a round of applause. So this is very, very crucial work, and it's been a big help to them. I'm sure we'll continue to partner with them and try to help one day end this very, very devastating illness. But for the work that he's done so far, the American Cancer Society wanted to present him with this small token of their appreciation, and it's my pleasure to present it to him this evening. Recognition for his work. So on behalf of their society, but also on behalf of the Borough of Manhattan, we want to thank him for his leadership. Thank you. In this issue and in many other issues, we look forward to continuing to work with you. So thank you very much.
This is the plan. Let me say this. I stand on the shoulders of strong committees. I stand on the shoulder of strong committees. If the committees are doing the work, then the president shines. When the committee does the work, the membership shines. When the committee does the work, the membership learns, they become better advocates, and they bring more members in. So I accept this award on behalf of the committees and all of my chairs and co-chairs and committees that work so hard, and all our 5 game changers and even our other committees, and how precious this award means to me. Because my mother is a cancer survivor. Because of her, she had TTP. It's a form of leukemia, and they came up with a new type of Rituxan, a new kind of chemo called Rituxan, where you take these shots every 6 or 7 months. And it's working, and her TTP is in remission. She was able to get her hip surgery done. She's doing her PT physical therapy every day, and she'll be out of canes shortly, but she is pretty much back to where she was prior to 2001, which began that nightmare for all of us, and all of you know how hard that's been for me. So I accept this award on behalf of all our cancer survivors, those who are still struggling with the disease, and on behalf of all of our membership. And you have to get in this picture too, and come on over here. I'm so honored.
That's good. Stay there. That's good.
We are symmetric, though. They call it an incline plane. Thank you. And let me just thank our Deputy Borough President, who's brand new to this position. But he is outstanding, doing terrific work. We just signed on to a letter, along with many other elected officials, asking HPD to do a moratorium on downsizing and massive evictions. So we're asking them to do a moratorium on the downsizing, stop for now, until we can figure out what the legal ramifications are for those individual people who have to struggle. Because they have these timelines, especially in NAACP, they say you have to be here. They give you these timelines and these time frames that you can never adhere to on time. And it's their way of evicting you really fast. And those who are not educated because of the work of our housing committee and the work of the borough president and all that you do, and we working with our people, is they don't know. They don't know, they panic, they don't read the notices, they ignore the notices, thinking it's not gonna happen to me today. And next thing you know, the marshal's at the door and their stuff is on the street. And these happen to some of our seniors. So we sent out a really strong letter, about a 4-page letter to HPD, very strong language. We signed on it right away. And hopefully, and I think we will get the answer that we want.
Yeah, we've been in touch with her. We're hoping for a meeting where we can discuss not only the complete shutdown of the downsizing, but ways we can help them fund so that we don't have to deal with this again next year or the year after. So that this doesn't happen.
Because this is a very costly process. And absolutely. With putting more people in the street costs more money to take care of, as well keep them in their apartments.
So if this is going on in your communities, please call our office. Any housing issues, any issues at all that are going on, please feel free to call our office, alert us to the issues, and we'll address it as best we can. All right, thank you for having me.
Thank you.
So, without further ado, I invite Ms. Michelle Coombs to introduce our guest speaker.
Each May, we celebrate Older Americans Month. This year, the theme has been Safe Today, Healthy Tomorrow, which really gears and focuses on injury prevention. Injury prevention can include home and fire safety, proper use of medication, and a huge one for our seniors is falls prevention.
Okay.
Okay, so this evening, the Health Committee has invited Mr. Walter Rutledge back to share with us the importance of exercise throughout our ages and also making it enjoyable and fun while doing it. Walter currently runs one of our dance programs at Harlem Hospital for our seniors in the community, which is a free program. That program started about 3 years ago, and we started with 3 instructors. One was offering body conditioning, we had a West African, and also a jazz class. Today we only have the jazz class because it was the most popular. Our seniors loved it, they perform. They're with Walter. Walter's there twice a week, and it's really a dynamic program. Walter, thank you so much.
How's everybody doing? I have a little bit of a sore throat, but you should still be able to hear me. If you can't, raise your hand, and I'll come towards you. Okay. Now, one of the things that we did want to talk about is prevention, because being proactive is really important. Most people wait till they get sick or get really overweight and say, oh, I gotta lose weight. Okay, but when you think about diet, what are the first 3 letters of diet? And that's what it feels like to diet. So what you really want to do is change your lifestyle. Okay, if everything's in moderation, yes, some things you have to eliminate as you get older. And you can run 10 miles a day, you can eat all the right foods and still have high blood pressure or still have high cholesterol. So it's very important that you check with your doctor, do the proper things with all of these kind of things. And you need annual checkups. I worked with a very dynamic lady for a while, and Eartha Kitt. And yes, and when I worked with Miss Kitt, she was about 70 years old. And she would come in, and we did a project together in South Carolina. I brought her back after being gone almost 35 years from the state. And I had to fight to get her there and fight to be acknowledged. And she would come in the morning. We did this television broadcast, and there were a lot of young people in the program. And so, of course, they wanted them there at 5 o'clock in the morning. So, oh, Miss Kitt, you don't have to come until 8. She came in at 5 o'clock in the morning in full makeup. And she said it takes hours to look like this. And the first thing she did when she came in was a handstand. So this lady was in great shape. She died of colon cancer, which is a travesty because it's preventable. Okay, so it's very important that you do check with your doctors no matter what you do. Now, most people think exercise is something 10 miles a day. No. You can do exercise around your house. Sometimes it's as simple as saying, okay, I live on 110th Street. I'm going to get off the bus at 108th Street. And everything is progressive. When I do a lot of personal training, and when I train people, if we start out by doing crunches, for instance, the abdominals, I say, let's do 4 sets of just 4. And they'll say, I can do more than 4. I said, no, just 4. So that means they've done 16. Next time we meet, and I try to get them to come 3 or 4 days a week, we just add 1. Next time they do 4 sets of 5. So if we work about 2 months, they're doing 4 sets of 25, and they never thought they could do that. So it's a progressive thing. And you can start very small and just keep building on it. The same thing with deciding what you're going to eat. If you just take one thing and eliminate it, and most things you should eliminate are white.
Thank you. Thank you.
But for instance, processed sugar, refined flour, that means white rice, white pasta, white bread, and even if you get whole wheat bread, read it. Because a lot of times whole wheat bread is still not healthy for you. You have to get, So if you just dropped one thing white, cheese, for instance, is not good for a lot of people. So if you just drop one thing white, I'll drop one thing white a month. After the end of the year, you'll probably have dropped 20 pounds without exercising, just by doing that. So there's lots of different ways to do things. And what I wanted to do today was to get you doing a couple things with me like we did last time, just to share some things that are really easy and to talk about why they're important. One of the places where most people, as we age, what happens is this: women especially have to be careful, especially after menopause, because you get osteoporosis if you haven't had enough calcium as you're growing up, as you through your life. And that basically means you have to stay active. If you stop staying active, like you say, you don't move, you lose in this case. And just because there's snow on the roof doesn't mean you can't have fire in the furnace. That's up to you. That goes for the men too. Men have it easy because they die off sooner. So usually there's less roosters in the hen house. More to choose, so they're more to choose from. So that's what we do. This guy is saying, yeah. All right. He knows what I'm talking about. But anyway, so what we want to do is this: we all want to stay active. And there's a couple of places that you really have to be careful about. We're going to start with the top of the body and work our way down. But one of the most important places is your rotator cuff. The reason being, you can hurt this really easy. And most people, when they get hurt, they're in denial. They don't want to give this enough chance to heal. And if you hurt this is not something like a little sprain, or I twist my ankle, comes back to week. Sometimes this takes up to 3 to 4 months to heal. And you really have to baby it. And if you don't, you start doing things that never heals. And then it becomes a chronic problem. We carry up, we have a purse, we carry the purse on the same side all the time. We don't switch off. Okay? If we carry groceries, we usually tend to put the heavier bag in one hand, the lighter bag, so we grab our keys. Okay? So these are things you have to kind of watch out for. Because these are ways we hurt the cup. We'll reach for something on a high place and not realize it was a little heavy. Then 2 days later, we'll go to raise that arm and say, ow, that hurts. And then we won't say, okay, I need to do something about that. We'll just I can work through it. I don't have to be submitted to the pain. And then it just keeps getting worse. So this is the first place we're going, one of the places we're going. Another real important thing is lifting our legs when we walk. We have a tendency as we get older to shuffle, to not pick up our feet. We've all been in a hurry trying to get out the train and we're behind that shuffle. On your way to work, you're late. Here's the shuffle. What can you do? You can't knock them. They have to stand right by. This is important because most people fall because they don't lift their feet. Okay, this is a big thing. And this is another reason why what we call the core is so important. We just got over the winter. This is even good for people who are, now basically I'm gearing this to people 50 and above. But when you get in your late 20s, you start thinking about this. Okay? Because that's when really your body starts, for men especially, it starts to change. Women, as surprisingly as it sounds, because men think they're so virile, around 28, men have reached the peak of their testosterone. It takes women that probably go to in their mid-40s where they still have much more of a drive. So that's why being a cougar is not such a bad idea. Really, you're putting out, you're getting the money's worth. Okay, so all that aside, let's get started. So we're going to do about 4 things because I want to let you go before well, it's too late for the happy hour. We missed that. So, but I don't want to keep it too long. I want you to have fun with this. So we're going to do about 4 different things. We're going to work, first we're going to work there's 3 forms of exercise which are really important. First one is breathing and relaxation. Yoga, meditation, Tai Chi, some forms of it. Even walking can be meditative. Getting it out of your system. Those are really good ways. And what they do is they calm you. They take the stress out of your body. The second most important thing is a calisthenic of some sort. You have to do something where you actually physically do something. Most people think that, okay, the cardio part, which is the last part, is the most important. I get on a treadmill and I can walk without burning calories. Well, if you eat one jelly donut, you'd have to walk from here to Yankee Stadium to burn the 400 calories. Now, if you do some kind of strength training, really your body will burn the calories as you sleep, as it repairs the fibers you have broken down. So it's much more an efficient way to work. So something where you actually do something physical, whether it's lifting weights or using your own body weight, something physical. And the third way is cardio, something to raise your heart rate. And that cardio is what it says, it's cardio. It's not really for calorie burning. You do burn some calories, but the trick is to get your heart rate going, to get your body going, your metabolism going. So you boom, boom, boom. Running is great. That burns, you can burn, like I said, about 400 calories in about an hour. Surprisingly, you only burn about 100 calories through sex. Which means one of two things. Either you have to have more of it or you have to go longer. One of the two. You might as well laugh. This is the way the world is. Okay, we're going to start with breathing. Real pretty song. So everybody put your hands by your side. And we're going to take a deep breath in. Here we go. And in. And let it out. Just breathe in through the mouth and let it out through the nose. Here we go. One more time. In.
I'll get it right. With no regret.
And let it out.
No guilt, no shame for this time. No, not
one more time. Here we go. In.
Once I surrender.
And let it out.
I won't dare look back.
Now, arms are going to come up.
I'll get off track.
All the way up. Good. And let's push it. Push it. Push it away. We can take it a little forward so we don't hit our neighbor. That's it. Good. One more time. Let's come up to the front. Up. And take it down. Now we're going to take a deep breath in. Take the arms up. And as we drop them, we're going to drop our chin. Let our shoulders go. Let our chest go. Let the weight go down. Just hang over. Very good. Keep going. Keep going. All the way over. Far as you can go. Right, that's it. And just stay there. Just stay there for a moment. Just stay. And now we're going to come up. First the hips. Then the waist. Then we're going to lift the chest. Shoulders back down. And lift the chin. And the arms again. And arms down. And the chin. Now the shoulders. Let the air out of the chest. Drop the waist. Now the hips. Very good. Just stay there for a moment. Let it all feel all the way to the bottom. And roll it up. Hips underneath. Feel the waist. And the chest. Relax the shoulders. Lift the head. Wonderful, darling. Isolate that. She was there. She was right there with you are. That's it. And one last time. Here we go. gonna do one more small stretch because I want to do something else without putting you to sleep. So now what we're gonna do is we're gonna take our hand, put it on the side of our head, and we're gonna, and whatever side we're gonna go put our chin toward that way. You feel that stretch? Oh, that feels so good. So we're gonna hold it there, we're gonna breathe for a moment. Then take that hand, wherever you feel a bump or a nod or some tension, that right there, that's my son right there. Work that out. Yes. Yeah, because you know how they do.
We do know that.
This is another era, I would beat him with a wet towel. You can't get away with that anymore. Oh, you pull the space open, that's it. And let the head fall to the center. So we got that. Now we're going to do the other side. We're going to put a little music to this. Finally figured it out. Here we go. And other side. Deep breath in. And let it out. Take another deep breath in. And let it out. Okay, now go find that place.
Tell me what's wrong with you now. Tell me why
And hand to the shoulder.
never seem to
Make the space long.
happy. Oh, heaven knows I try.
And drop the head to the middle.
Does it change?
And now bring it up.
Tell me
And we're going to the other side one more time. Here we go. And
I can sense
let the arm hang.
you're driving me wild. Break up to make up, that's all we do. First you love me,
This
then
way.
you hate me.
Yes.
That's
You did it right. That's it. That's it. Good. Okay, now take the hand to the shoulder and make the space as long as you can.
we do. First you love me, then you hate me. That's a game for fools.
And drop it to the middle. Now let's take the arms up and let's make stretch one high and the other.
Talking about a pair of jeans.
Good.
Now tell me I'm wrong.
Good. Now open the mouth.
Say it's good.
Very good.
I'll say it's you.
You can sing along. It's a great song. Here we go. Now. Yes. Now we're going to move a little bit. 5, 6. Here we go. Left, center, right, center, left, center, right, center, left, center, right, center, left, center, right, and center. Now left and right, left and right, left and right, left and right again. Left and right. Now up, center, down, center, up, center, down, center, up, center, down, and center. Now up and down, up and down, up and down, and up and down. Now left, center, right, center, left, center. Let me hands off. Left, center, right, center, left, center, Good one.
Mr. Walter Rutledge, thank you so much, Mr. Rutledge, that was wonderful. We're sorry to stop this, and so the last presentation for this evening by the Health Committee will be done by Ms. Pauline Bostic and her talented team. In January, Ms. Bostic volunteered for her team to prepare healthy offerings for this evening's refreshments. And so all of the food that you see here has been prepared by Health Committee member Ms. Pauline Bostic. Please, Ms. Bostic, would you come forward? Thank you so much. And so are we ready? Are we ready? And so we're going to close this meeting. Thank you all for joining us.